Cardiovascular response to lower body movement dysfunction in Division II collegiate swimmers, presented by Rebecca Bradford, Rebecca Frost, and Victor Romano.
This study was conducted at Catawba College in Salisbury, North Carolina, with the college's swim team. There were 18 participants. Of those participants, 12 were males and 6 were female. These participants' average age was 19.7 plus or minus 1.3 years. Their average height was 176.9 centimeters plus or minus 8.63 centimeters. And their average mass was 74.1 kilograms plus or minus 8.48.
The method of this experiment was as follows. The participants were asked to complete an overhead squat analysis, 2-minute maximum wall sit, and a 2-minute maximum plank prior to completing a mock-style swim meet. Then they were asked to complete a mock-style swim meet. This meet entailed the swimmers sprint 200 meters of their specific stroke. After their maximum exertion level was met, the swimmers' heart rate and blood oxygen saturation levels were assessed.
This is a graph comparing muscular imbalances and the training heart rate. Looking at the correlations between muscular imbalance and training heart rate, the graph shows that there is a relationship. However, there is no causation. It shows that the more muscular imbalances that were present, the lower their heart rate was.
Similarly to the previous graph, we are comparing muscular imbalances to the training heart rate max percentage. We found that the higher their performance was, the swimmers had fewer muscular imbalances. This means that the less muscular issues you endure, the higher percentage of heart rate is achieved.
In the final graph, we compared the amount of time training to the muscular imbalances to see if there was any correlation. This graph showed a relationship. Despite having a lower correlation, it is still relevant.
The results that were gathered from this study suggest that there was no significant lower body postural factors that affect the cardiovascular response. However, the data did present multiple meaningful relationships with cardiovascular response. In order to determine a significant correlation, results needed to be above or equal to 0.95. The meaningful relationship that was found during this study was 0.71.
Managing an athlete's fatigue is a balancing act. Too much rest does not promote elite performance, whereas too much fatigue and an athlete's run the risk of changing their mechanics or even injuring themselves. This fatigue leads to musculoskeletal adaptations that can cause athletes to shorten their strokes and use non-optimal movement patterns. This study shows that doing this affects overall output through the decrease in cardiovascular response. In sport of competition swimming, even if the effect is modest, it can be extremely relevant for the athlete in the serious competitive situation where 1/100th of a second may determine the difference between rankings or even breaking a record.
Although our data was not scientifically significant, we did find meaningful relationships between lower body dysfunction and exercise heart rate that may improve swimmers worldwide. Our data suggests that having the ability to assess and then correct these muscular imbalances may lead to improvement to cardiovascular response.
This was presented by Rebecca Bradford, Catawba College graduate, 2018, with a BS in exercise science with psychology minor. She will be attending graduate school in the fall of 2018 to study occupational therapy. Also presented by Rebecca Frost, a Catawba College graduate, 2018, with a BS in exercise science with biology and chemistry minors, continuing studies to become a registered nurse and further on to become a physician's assistant. She is a current certified nursing assistant. Also presented by Victor Romano, an assistant professor of sport and health sciences at Catawba College. He is the program coordinator of exercise science.